Supported by a series of strong evidence, the breakthrough advancement made by TDXD, which is representative of the anti-HER2 ADCs, have the rewritten the treatment landscape of gastric cancer, offering more the options to the patients. So, please, would you please give us your consideration or discussion about how such drugs they could impact on the clinical practice in the future, and what is your expectation for the clinical application of TDXD as a second line, even in the future for the first line? You know that recently there's some biotech that just try to test if the anti-HER2 ADC combined with PD-1 or PD-L1 antibody to apply it to the first line gastric cancer with overexpression of HER2. It is still in the process of trial. So what's your expectation? So would you please, first I would like to invite the Professor Koji Kono.
Okay. So TDX is the first ADC, especially developed in Japan, so applied to the HER2 overexpression gastric cancer. The facing in the ADC era for the gastric cancer, providing a new treatment strategy and bringing a new idea for subsequent drug development. For example, from the Destiny Gastric 01 to 04 studies, the explanation of the TDX in the gastric cancer have mainly been a monotherapy. But in the future, maybe more possible combination, as Professor Jin showed that with the anti-PD-1 antibody can be explored, such as and also such as macromolecular monoclonal antibody, or maybe combined with a molecular targeting agent. Something like a combination treatment will be more expected to get a more ORR or more better OS. As for the application of TDX in the third and second line treatment, whether there is a reliable biomarker predicting the prognosis and assessment in the selecting the advantageous population remain to be explored in the future.
Okay, thank you. So, Professor Zhang, from China, not only limited to China, but in the world, we know that Professor Zhang Xiaotian and Professor Shen Ning, you are leading teams and also pioneering teams in the past more than 10 years. You did a very good job and also make a lot of contribution to the gastric oncology area. So I think that you can share your experience and your consideration to our audience.
So Professor Li, I'm so flattered by your praise, and in fact I feel a lot of pressure to do good job for treatment of gastric cancer over the past years. So we are in collaboration, led by Cisco and JESCO and FACO. So I think it really offers great opportunity for our young oncology to combine together to do clinical trials. So as we talk to gastric cancer, especially HER2 overexpression or HER2 positive gastric cancer today, I think the ADCs, the emerging of ADCs, including TDXD and other new agent on the trial, I think it's given us a window to change the diagnostic strategy for gastric cancer. So just as Professor Kono mentioned just now, we should test the patients' HER2 status before and during and after treatment. So by this a series of tests to help the oncologist to know whether the real-time HER2 status, and also it will tell us which patients have the tendency to be HER2 changed after treatment. It will teach us. We will teach a lesson, try to learn a lesson from each patient. So it's the first thing that we should have the HER2 test from the very beginning to the last. Since we have the ADCs currently covering all the stages of the clinical stages for the clinical trials from the first line to the third line. So T-DXd was first applied in breast cancer, so extending from backline to the front line. Currently in breast cancer, we know that it's neoadjuvant and adjuvant settings. So in gastric cancer, I think we can also learn a little from breast cancer. First is a full course. Second is expanded to the HER2 low expression. So patients. So with this as a reference, I think T-DXd has moved from third line to second line and is currently progressing towards the first line. And I hope that with the very rapid development of other new agents, we should consider the how to optimize the strategy, since we have different anti-HER2 treatment, including anti-HER2 ADCs, monoclonal antibodies, bispecific antibodies with different strategies, and at the same time, we have different new agent of IO. So it gives us new opportunities. Of course, it's more challenging to design study in a smart way. So how to save patients and how to do the clinical trial efficiently, I think is a problem that is facing us. But I'm confident we can do better, since currently we have a lot of new methods, including AI-driven study design or other multimodal modalities. So I think the future is very promising.
Okay, thank you very much for your sharing the view of the HER2 expression in gastric cancer, because the gastric cancer is a highly prevalent specific cancer in Asia area. So thanks to Oncology Frontier to provide us a very good opportunity to discuss the situation in Asia countries. And Professor Kono is the president of JASCO and also shared the experience with us about what the situation in Tokyo, not Japan. And Professor Zhang is also sharing with us their strategies, and including the data. I mean, Professor, together with Professor Shen, you did a very good job, and they launched several clinical study in gastric cancer in China. So I think through today's exchanges with our knowledges and our consideration, and we have systemically reviewed the epidemiology and characteristics of those specific gastric cancer with the high expression of HER2. So I mean the T-DXd is a very strong activity with HER2 expression gastric cancer. In the future, we can. I hope that in the future we will put in from last line to the second line, then put into the first line, combined with some other target agents, for example, the PD-1 antibody. So we look forward to the further optimizing the gastric cancer precision medicine, the treatment strategy design to specific patients, and for in the future we have to look into the stronger, the anti-HER2 agents to help our patients. So once more, I would like to thank you for your heartfelt. I mean, thank you for heartfelt to thank you for your sharing your contribution, and I hope that we in the future we can work together to develop the new strategic treatment to the patients, especially for gastric cancer, but not limited to gastric cancer, but also the colon cancer, even the lung cancer or something like that. So we especially can focus on our the specific the cancer in Asia area, for example, liver cancer, the nasopharyngeal carcinoma, and gastric cancer. It's Asia-related cancer. So that's. I would like to thank you for your valuable contribution and to the audience for your attention. So this concludes today's interview. So thank you very much, and thank you for your help us to finish this roundtable discussion.
Thank you, Professor.
Thank you.
Thank you.